good. Siapa dia? Siapa dia? Siapa dia win? Yeah, okay.
I think the CIH has enormous potential to, first of all, do very, very meaningful and practically significant research, and meaningful and practically significant training, and engage in meaningful and practically significant education.
One of the greatest pleasures of my job as director of the Center for International Health has been seeing and experiencing the field of international health grow rapidly at the University of Toronto. The main goal of this conference is to continue building the international health research effort and community here at the University of Toronto, especially to make our contribution in addressing the divide in the world, which sees 90% of global health resources being spent on problems that affect only 10% of the world's population.
I would try and concentrate on a package of the most vital services, but I would put a sustained commitment behind them. I think to try and do anything in less than 10 years, with less than a commitment of 10 years, has only very modest chances of success.
We had a discussion about this. There's one member of the audience who will recognize this phrase, get them young and you'll have them forever. I'm told it's a Jesuit phrase, but I think it's important. As you saw, I was exposed to international health research early on in my training, and as Dr. Evans said, our ideas may be brash, but the enthusiasm that people have at that stage is important, can make a contribution, and it can have important impact on their future decisions.
When I was contemplating my choice of medical school, one of the things that was very important for me is, would I have the opportunities to do overseas projects? Would I have the faculty mentorship? And it just seemed that through the center I was going to be able to achieve that. I mean, that's really what students need when they're contemplating this. They've got the enthusiasm, they've got the ideas, they need the support and the guidance, and that's what the center provides. One of the most memorable experiences that I think I've ever had was in Cambodia. There was a little boy who we met named Sang Thi. When we met him, he was in shock. He was in real trouble. When we tested his blood for malaria, he was very, very positive. So we hooked up an IV in the field and threw him in the back of the truck and held him in my arms with his father all the way to the hospital. And he needed a transfusion. And it was one of those little miracles. His blood type turned out to be the same blood type as my blood type. And only 9% of people have that. And so he had a transfusion from me. And we left for the evening thinking that everything was going to be okay and that this child was going to survive. And we were quite excited about it. So the next morning we got up really early and went to the hospital, only to find out that he had passed away in the night. But until you meet a child and watch that child die, it doesn't hit you in the same way that the numbers do. It's not fair, it shouldn't happen when we can do something about it.
We in
in international health have chosen to focus on those outside of our own boundaries. There is a fine line, though, because our international experiences are very much important in dealing with many of the problems in our own multicultural Canadian society and in our Torontonian society. But more than that, though, there are the millions of people, the huge masses, literally, of people dying and suffering around the world. So those who are involved in international health seem to have this perspective on life that we must give back, that we must share what we've got, that we must make a contribution to those who are suffering.